Many families are finding the use of cannabis products to be very beneficial in healing Alzheimer's and other neurological conditions. So today we want to talk about what's working and what's not working for these families so you can make your own educated decision if cannabis products might be of benefit for your loved one living with dementia. Hello, I'm Luciana Mitsko, and this is Ahead of Dementia. Most of what is known about dementia and the processes in the brain have been found only recently in the last 20 years. That's because research in dementia patients is extremely difficult. Very often, caregivers and doctors find what is beneficial for dementia patients way ahead of the researchers. And this is indeed the case with the use of cannabinoids. Cannabinoids are compounds found in the cannabis plant. The most common cannabinoids are the THC and CBD. Families caring for loved ones with dementia often use cannabinoids with the intent of treating dementia or preventing dementia. In terms of prevention, it is quite possible that the use of cannabinoids may help prevent dementia or slow down the worsening of the symptoms. There are studies that actually point out to the effects of particularly THC in slowing down the formation of amyloid plaques. Amyloid plaques are those strictly related with Alzheimer's disease, is one of the pathology of the disease. Some research also indicates that cannabinoids reduce the neurotoxicity in the brains of rats. While we are still really far from replicating the same benefits in the human brain, there's a lot to be hopeful in the use of cannabinoids to prevent dementia. However, in my experience as a care consultant, I have never encountered a family who was successful in preventing the worsening of dementia with the use of cannabinoids. Where I've seen cannabinoids being used with extreme success is in the treatment of the behavioral and psychological symptoms of dementia. We often look at dementia as a condition that affects cognition, mostly memory. But dementia is much more than that, and it often creates psychological and behavioral symptoms such as apathy, agitation, depression, anxiety, paranoia, delusions, hallucinations. For some patients, these symptoms can become really severe, especially when it comes to stage 6 of dementia. If you don't know in which stage your loved one is, go to our website, aheadofdementia.com, and download the free PDF with the stages. It is in mitigating the effects of this kind of symptoms of dementia, the psychological and behavioral symptoms, that countless families have reported having benefits with the use of cannabinoids. Usually, doctors will try to treat the symptoms with psychotropic medications, including antidepressants, sedatives, anti-anxiety, and antipsychotic medications. These drugs may have severe side effects that can be very debilitating to the patient. Many times the patient will suffer from a lower energy level, and you see sometimes when you enter homes when they are sitting in the corner, chin to chest, many times that's the effect of the psychotropic medications. The other adverse side effects is an increased risk for falls and many times the patient who is behaving and having fewer problems with anxiety or hallucinations are falling and breaking bones, having to go to the hospital. So it's exchanging one evil for the other. As an alternative, many families have chosen to use cannabinoids to try to mitigate this kind of symptoms and reverse some of the symptoms of dementia. These families have reported a lot of benefits. Some of them include a calming effect, reduced agitation, reduced irritability, reduced apathy, reduced anxiety, improved mood, reduced impulsivity, improved sleep, decreased incidences of delusions, better chronic pain management, and weight gain. In addition, cannabinoids are considered much safer than psychotropics, have lower side effects, and cost far less. Cannabis is legal now in many states, and cannabinoids can be found in many different formats: creams, oils, edibles, and yes, smokables. Edibles are a favorite form of cannabinoid for many families because they can present it in a format of a nice treat, a little piece of chocolate or a gummy bear that patients will happily enjoy taking it, as opposed to a nasty little pill that sometimes they say, no, I don't want to have anything to do with it. So that's another benefit of using a cannabinoid. The way of deliverance is much more pleasant and appealing for the patients. If you are a caregiver considering using cannabinoids to treat your loved one with dementia, please do consult with your doctor. Last week, we talked here about the importance of having a good doctor who is knowledgeable, experienced with dementia patients, and can also listen to your concerns. This is when having a good doctor, a trusted doctor, will make the whole difference in the world for you and your family. Each person reacts differently to the use of cannabinoids. Each brain is completely different. And cannabinoids can have interactions with over 200 commonly used drugs, and some that your loved one might be taking to, let's say, treat a heart condition or even high blood pressure. Do include your doctor in the decision-making process if you are considering using cannabinoids for your loved one. The overall safety of your loved one should always be in the forefront of your approach. It is worth noting that cannabis is not approved by the FDA for the treatment of Alzheimer's and other dementias. However, neither are any of the other drugs commonly used for the management of PTSD in dementia patients. We really don't know what will it take for the research to catch up with what the caregivers and doctors already know and have been experienced in the field. What you can do at this point is continue treating your loved one with your heart and with his best intention in mind, and always with the close advice of your trusted doctor. If you have had any experience in the use of cannabinoids in treating dementia, please leave a comment below. Your experience can be very helpful to other families experiencing the same issues. Thank you for watching and stay ahead of dementia.